Okay, so I'm opening the webinar now for people to join.
Hi guys, am I audible enough?
Yeah, Whitney, you're audible.
Okay. Sorry for the delays. So today we are having a session on time management in med school. One of our speakers is already here. She's Dr. Esther Dindi. She's a consultant physician, a founder and a CEO of Dr. Fitness, Fit Sister, and many other things. She's also very esteemed. I personally admire you. Good The moderators for today is Alister and I, and Alister can take over from now. Yes.
Okay, good evening, ladies and gentlemen. Thank you for making time to actually come for this webinar. And great thanks to Dr. Esther and Dindi for actually making it. And thank you so much. So before we begin, let's start with maybe the introductions. You can write on the chat box maybe your name and something interesting about you. Yeah.
As you're doing that, Dr. Dindi, you can start over. Tell us about how you've been able to manage like all that you do, being a doctor and managing like when you're a student, how you're able to manage the social aspect of your life with the educational aspect of your life, like balancing all that, like considering how tough med school can be, especially on like time.
Okay, good evening. I'm really excited to be here today. It's really a pleasure and an honor that you guys considered having me on board. So I believe that you're going to have a good time together with you and the other panelists as soon as they join. I've already been introduced. I know people struggle to pronounce my second name. It's Dindi. My surname is Dindi, D-I-N-D-I. I am a medical doctor for sure, so I'm excited to be working in this space. A few years ago, I was in your space. I graduated from a medical school in the year 2005. So maybe the challenges you're dealing with currently might be fairly different from what we dealt with. At that time, being online was not as ubiquitous as it is right now. We didn't have much of Facebook. In fact, I joined Facebook way after internship. And there wasn't Instagram. Those are new things. So, and I know they post new challenges. So back in our days, we were very analog. Not everyone had a phone. As a matter of fact, I got one after graduating from medical school. So that's a while back. And even my share, just honestly, I must say that I wasn't the perfect student. And I know no one is perfect, but I tried to make the best of what I had. And so really going through medical school was basically attending to what was compulsory and then taking care of my personal life. So compulsory basically just means that I had to attend the classes, I had to go for the ward rounds when I came to the clinical area. So I don't know whether in this audience we have people who are not yet in the clinical training whereby you're already going to the wards. So we might be a mixed group for sure. So there's the basic sciences and there's then when you go to clerk patients and then you present to your consultants and all that. So basically my objectives was to prioritize as to what was compulsory. What really took me to medical school was to study medicine, to be able to learn and get the skills and be able to get out here and be able to practice. And therefore, that meant that I attend all the lectures. At least I did 99%. So yeah, as much as possible, so long as I was well, to attend the lectures, go to the dissections if it was the morgue, do the assignments, go to the wards, do the clerking and all that. So in essence, that took the priority and the center stage. And then, of course, life is much bigger than academics. As you'll realize, you'll eventually graduate, leave medical school, and life is so much bigger than just practice. So I still took care of my social life. Of course, there are other aspects that support us through medical school in terms of we still need to be in clean clothes. So we have to wash our clothes. So taking care of laundry, getting our meals, whether that's from the mess or where you get your food from, or whether you're cooking, it depends on where you're staying. And then of course you still need to sleep. That's part of living. So sleep can take quite a bit of time because you need to sleep for 7 to 8 hours. I know towards the end or when you're preparing for exams, that might really be reduced significantly. I'll not say I'm Dr. Fitness, yes, but it's not that I took exercise so seriously. Most of what I did was just walking all over the place in town. And, I trained in Moi University School of Medicine, so we'd walk to town in Eldoret and all that. So, and then there was time to relax, hang out with colleagues, or was it fellow students. Sometimes we'd hold bashes and just, interact and have like team building activities whereby we just play and relax and that kind of stuff. So all that is important in as you go through medical school. And then, of course, most importantly, I must say that I dated throughout medical school, actually from second year. And the guy I was dating is currently my husband. We are married. This is now our 15th year in marriage. He's a fellow in cardiothoracic surgeon. So he's a general surgeon who is now about to complete his fellowship in cardiothoracic surgery. So yes, that just tells you that you can have a balanced life in medical school. You can be all-rounded. You can take care of your academics and succeed. You can be social. You can interact. You can make friends. And if you meet a good girl or a good guy that you think you can settle with in the future, hey, come on, don't miss the opportunity. Someone was joking that, I graduated with 2 degrees because we ended up wedding 2 weeks after graduating from medical school. So I think at this point, I probably leave it at that. Because there are other panelists and maybe I hear from you, there's much more I can share, but for now, I'll put a pause. Back to you, Alister.
Oh, thank you so much, Dr. Dindi. I'm sorry if I'm not pronouncing it well.
It's okay, you're doing very well.
Okay. So it's very interesting about your story, but I had a question. Like, did you have a schedule or a timetable for what should happen at what certain time?
I must say that I am not one of those super organized people. I know it's advisable to either use your Google Calendar or have a notebook, have a calendar, a physical calendar whereby you really organize yourself. And that's very advisable, but it's just good to also learn what really works for you. So the most advisable thing is to have a calendar, have a schedule, so you don't miss out on classes, you don't miss out on appointments and things that you're supposed to do, including social events as well that are coming up, so you don't forget and all that. But I think for me, the thing is that classes are compulsory. There's a timetable, and that one I had to stick to. As for the other things, I just coordinated myself. I would know that on this day I'm meant to be doing this thing. But the other thing is that besides the class work, in terms of the other things, I would kind of, when I'm going through an activity, like I would set time and know that I'm going to be washing my clothes on Saturday between 10 and 11. And maybe that's the time I would listen to some music or do, something that I would be able to catch up with, or maybe catch up with a friend. We are chatting as we wash our clothes. So I would set times aside and know this is my feeding time. This is my laundry time. This is the time I'll take a walk in the evening. So yeah, I may not have been jotting it down, but I had it very clear in the morning. What were my events for the day? And, for the subsequent day, including small things like knowing what I'm going to eat, because at some point I decided to take care of my menu. Of course, if you're going to the mess, you don't need to do that. So that is very helpful. If you're the kind of person who likes to jot it down, I would really highly recommend that. But I'm kind of freestyle, and that's how I did it. But I am always till date, I'm very clear on what I need to do when and how much time I want to spend on it. And I tend, currently I tend to set a timer. I mean, most of us, we have smartphones. And so I set a timer as to maybe I want to do this activity for this 2 hours, but in between I want to take a break and maybe stretch or do something. So that's how I kind of handle my time. And it's just good for you to realize what works for you best. One other thing I would highlight is that in medical school, I got frustrated initially because I noticed that a number of my colleagues, if you are not having an early morning class, they'll tend to go to the library and study from there. And so I tried that and I realized that I was not able to concentrate. And that happened to me on several occasions. I go to the library and I start feeling sleepy. I know it's crazy. I should not be saying this. And for the majority, people tend to concentrate best in the morning when they're really feeling fresh. That happens not to be me. And so I discovered that I concentrate best in the evenings. And so I switched. My study time used to be mainly in the evening, sometimes in the late afternoon. And so it's just good to try different things, especially when it comes to self-study, and know what works best for you. I am an evening person. I could study late into the night and then not have to wake up very early unless I have an early morning class. But for the majority, I think I'm abnormal. For the majority, they find it easier to do that in the morning. So just experiment and see what works best for you, but don't neglect your responsibilities. However, I would say that when you freshly had a class, let's say you've had your biochemistry class, you're studying something new, maybe you're discussing cardiovascular disease and you've just had a lecture on that, it's highly advisable that you try to look through the material within the same day, because what happens is that you kind of put it in your memory. When you revise, when it's still fresh, you look through the material, you tend to grasp it better and it tends to stick better. So don't wait until a much later date to review your notes. Review them sooner, and then the rest of it you can do maybe when revising for your exams. So I am an evening person, and even now as a mom, as a practicing doctor, as an entrepreneur, I still tend to do most of my things, plan for things in the evenings, because I even work out. I know most people exercise in the mornings. I tend to exercise in the evenings. So just know that we are different. We do things differently. We can all succeed in medical school, just adhering to the principles, but discovering what works best for us. Someone will study in the evening, another one in the morning, and they can all succeed and have good grades. Yes, have I answered you, Alister?
Yeah, you have. It's such okay. It's so inspiring that you can go through what you are going through right now and still succeed. And actually, I'm really, to be honest with you, you're just empowering. And as also being a female, you're just empowering. And thank you so much for the advice. You said that you can experiment, because of late I know my timing and my time management has been just very, very off, especially when Corona came through. Yeah.
Yeah,
And yeah.
that can happen. That can happen. And I think some things can
And
throw
so
us off guard. And it's good not to get overwhelmed or feel stressed, and know that as much as we plan, sometimes we really have to adjust. There are things that will not be anticipated, but we still have to be sort of elastic. If you realize that you were planning to study at a certain time, then once in a while, I don't know whether it's still happening, you'd have a random class, or maybe a lecturer who missed their session due to some inevitable circumstances, and then decides, oh, the class is going to be at 4 and maybe it was meant to be at 2. It's just you can readjust and maybe shift what you're going to do at 4 and do it at 2. So it's good not to be rigid. Like now COVID happened, this Corona, and we did not expect it, and so it's thrown us off guard. We had timelines, we had goals and all that. So it's just good to be able to adjust, and then realize that you're not the only one. And the thing is that time is interesting. As much as we are talking about time management, time ticks away. Whether you're utilizing the time or not, it's going to tick away anyway. So the thing is that you can, in the real sense, philosophically speaking, you cannot manage time. You can only manage yourself to see how you can utilize your time to the best. And the thing is that we all have 24/7, as in every day of the week we have 24 hours, and some people can achieve much more than others. It's just good to see what is your best version, what's your best capability, what is the most you can do within those 24 hours and ensure that you're serving yourself best, but knowing that we are all different. So when things happen unexpectedly, you can still adjust and still be able to achieve your targets.
Yeah, and that's true. That's true. So not to be rigid, but it's to be flexible and adapt to changing times.
Yes, yes.
So there's some questions here, and
Mm-hmm.
Benjamin Wafula was asking, how
Yes.
how is dating during your med school, and what experiences did you have, like if you didn't have enough time with your partner, or yeah.
Okay. It's interesting. Oh, but then let me tell you, I strongly believe that the best time, I could be wrong, but I strongly believe that the best time to meet a life partner is actually in college. In college, you're so innocent, you're still learning, you're so adaptable, you're past adolescence for sure, you're a young adult, you don't have much resources. However rich your parents are, that's not your resources. You might not have much, and therefore the kind of people you meet in medical school, okay, not, I'm talking to medical students, yes, but the kind of people you're likely to meet in that space in college, they don't have a lot of baggage. A few, you might be a single mom or single dad, it's not very common, but most of the people you've not been through a lot of broken relationships, you don't have kids, and you've not gone through a lot of trauma, because sometimes when someone has gone through a lot of heartbreak, they tend to have a lot of baggage, a lot of trauma, and a lot of healing that they need to go through. So in medical school or in college, you tend to meet someone who is like a blank page, and together you can write on it. And that's just me, because I caught it all through medical school. And so going through it, of course, my husband was my classmate, and so we went through the stresses. Medical school, I know I don't have to tell you, can be very stressful, but let me tell you, you will overcome. Don't worry, I went through medical school. I'm a specialist in internal medicine, so I've already done my master's, and since then I've practiced for over 5 years. So I've been practicing medicine for the last 15 years. But the thing is that that experience of medical school, you get to see someone at their best, you get to see them stressed. That time you have cuts, those continuous assessment tests, or you've been through an exam and you're like, 5 of those questions, I am not sure I understood what they wanted me to write about. That long essay question was just crazy, or the OSCEs, if you are doing clinical exams, was just, there's all that, and we're human beings, and you will feel the stress, and it's just good to go through, see someone at their best, at their happiest moments, and at their lowest moments, at their stressed moments, because life, even in marriage, will be like that. There are times that will be good, there are times that will be hard, but the thing is that you adapt, and you get to be able to adjust accordingly. So of course, for us, most of the time in the evenings when you've done the classes, you're kind of unwinding. We took a lot of time to we didn't have a lot of resources, by the way. Sometimes we'd go have, coffee. There's a place called Click. You'd have tea, share the few shillings we had, and that was really exciting, and just chat. And I think you have a lot of time, a long period of time to get to know this person. And don't worry if it doesn't work, that's still okay. You still have time to meet other people, but it's doable, because you just want to get to know this other person and see whether you actually connect, whether you have the chemistry, whether you share in values, whether you share in the core beliefs and principles, because those are very important. And if you realize that you're not how much, then you can move on respectfully and break the relationship, move on to the next one. But I would say it's a perfect time to get to know someone, get to interact with them if you can, and your matters are becoming serious. You can then even get to meet their family, their siblings, and all that, and just get to start knowing the family and all that. My husband met my family in third year. That was 1 year after we had been dating. He talked to my dad, and of course our parents were very clear. You went to medical school to study, so until you're through with medical school, we are not going to give you our blessings to get married. So anyway, so that was clear. But we had a lot of time to study one another. We disagreed, which was normal. And I must highlight that we come from different cultures. I've been brought up in Machakos. My parents are Kamba, so I am a Kamba. My husband's parents are Luya, so he's a Luya. They're Luyas from different sub-tribes. And so we come from different cultures, and it was exciting to just get to know each other and interact at that level. And we disagree, but with time our disagreements became less because now we were more cohesive. We learned how to disagree respectfully and harmoniously, and all that. So yes, if you get a girl you fancy, Wafula, or a guy you fancy, my Alister or whoever else, please give them a chance. We didn't have money, and I think the other mistake we make in medical school is you're looking for someone with the resources. We didn't have much resources, but now we have resources. We are working doctors, we are business people, and so resources come. So long as someone is made of the right clay, they have the potential, they have the ambition, they are willing to grow, they will. So don't look for ready-made things. Look for something and someone you can work together to create the life you actually want. Oh gosh, I know I can go on and on and on this matter, but for the moment being, let me leave it at that. Back to you, Alister.
Okay, so now I'll take over from Alister.
Mm-hmm.
There was a question on how you are able, like the transition from theory years to clinical years. It's really, for some people, they find it like really tough. How are you able to do it?
The transition from
the theory years to the clinical
mm-hmm.
years. Yeah, how are you able to like grasp it and continue doing it really well?
Okay, that's quite it's a very good question. I mean, really, our training, medical training is very interesting. And by that, I congratulate you all, even for making it to medical school and to whatever year you're in. You're truly salute. It's not easy. I think if I went back to medical school, I don't know how to perform now. I'm still reading. It's really a training that's lifelong. But the thing is that personally, I found clinicals much more interesting than the basic sciences, the biology, the chemistry, the pathology, and all that. But, being theory, some people are very good at reading through, almost cramming things and, being able to reproduce that in exams and pass. But I must remind you that it's actually just understanding those basic sciences and the foundational studies in medical school that really helps you in the clinical area. So of course, the transition in the clinical area significantly is in that now you're translating that theory, whatever you learned in the basics, into practice. You're trying to look at a patient and understand what was that thing about acidosis, and how do these electrolytes now influence the patient's presentation and all that. There's that challenge, but that's where, when you get to the clinicals, the art aspect of medicine comes in, because medicine is not only a science, but an art as well. And it's in the clinical area that now you start integrating the science with the art. So in the basics, you study a lot of science, but when it comes to clinicals and now you're in the wards, there's a lot of having to learn the art. And it starts with being able to talk to the patient or even the caregivers of the patients and extract information that is essential for the management of the patient. So the clerkship is quite a challenge. Initially, you might feel intimidated. You don't have all the knowledge. You have it, but being able to ask the right question, the history taking, clinical examination and just being able to formulate a diagnosis and come up with management. I mean, those are the basics of now clinical training. And so one, it's going to feel intimidating at first. It's going to feel overwhelming. You need to gain the confidence to be able to talk to the patients. And so that's important. And you need to know that even the patient, especially if they know you're a student, they know you're not perfect. They know you've not even learned yet what medication you might need to use, what dosage and all that kind of stuff. And that's why you have your consultants, your clinicians, and if it's in a setting whereby you have residents or registrars, they are there to help you. So it's good to seek guidance because you're a trainee. A trainee means that you have to learn things and you have to go to the field. It's like you can't become a soldier without getting to the battlefield. So the thing is that that's where you become good because you're going to be a doctor. So the clinical skills are the ones you're going to utilize for the rest of your practicing life. So don't be afraid to make mistakes. You're not the one responsible over the patient. You're a student, so there are doctors taking care of that. Don't be shy to ask questions. Don't be shy to ask for guidance, and don't be shy to read your Archisons or whatever materials you're using currently to study clinical clerkship skills and how to even examine a patient. And then you must keep going. Every time you see a patient, talk to the patient, examine the patient. You have an opportunity to come back, realize there are questions you did not ask, and come back and ask them again. By doing this over and over again, that's why medicine is really something you get better by practice. You become better, and next time you know, oh, I need to ask this question. I need to ask about the family history. I need to ask whether the patient smokes. Then you start realizing some things, like if you ask a patient, do you drink alcohol? They'll say no. But if you just ask them, okay, what type of booze do you drink? Then they'll be open to tell you what it is. You know, there are those fine skills that you gather with time. So don't beat up yourself if you make mistakes at first, but you'll be able to get better. I want to encourage you that it's doable, but it's not easy at first. But the other thing that is very helpful, please clerk patients, present them to the consultant, present them to the medical officers or even the interns. If you have some in the hospital you're training in, take advantage of that, because that's how you keep getting better. And present to your immediate senior before, like if you have a medical officer working with you, present to them first before you present to the consultant, because they've gone through that recently, and then you feel less intimidated talking to them before you talk to the consultant, and you'll become better. It's doable. The guys who've done it before, we who have done it before, and many other people do not have two brains. We just have one brain like you, and you've already achieved, you've managed to come to medical school. You can do this, you can succeed, have that confidence and go forth and do your part, and you're going to succeed. I hope I have answered you.
Wow, that's it. Yeah, I think you've answered very well. So I'm going to take 2 more questions from the panelists, from the chat box. So the first question was that how can, in both the clinical and preclinical areas, how can you study, what method do you use to study such that you can just take little time and absorb as much as you can?
Okay, that's a good question. Once again, I'd like to echo something I said earlier, that really we all have different studying styles, and we all have different ways of remembering things. Some people are more, they're more pictorial. You remember images better. You remember maybe mnemonics better and that kind of thing. So what I discovered for myself was that was back then. I'll try to relate it to now, was that I would go through the material that we'd been given. Interestingly, in medical school, in Moi University, we used a different method that we used to call it student-directed learning. So we would actually meet in groups, set up objectives. We'd have a tutor with us or a lecturer to guide us to set the right objectives, and then you go read by yourself. So Then having done my master's in the University of Nairobi, I noticed that they're given notes a lot. So they have lecture notes. So it's easier. I was almost jealous, but it's okay. Having trained through the student-directed learning, it helped me a lot in master's because I already knew how to guide myself. And so if you're lucky and privileged to be having lecturers who give you notes, then you just go back to the notes, revise them, then read through books to expand your knowledge, to broaden the scope and see whether different reference materials, maybe Ganong versus, was it, what was this other book from physiology? I'm forgetting it, and see which one you're able to understand better. There's one that would expand. Ganong was like a summary. Then there was this other book that was really big, but it would make it easier to understand. So looking at those books, then what personally I would do, because for us we'd rely on the books a lot, we were not having lecture notes. A few lecturers would still share with us some lecture notes, but I would then do my notes, like try to compress them, create my own mnemonics. Some of them, maybe it was Canva words or whatever words that made sense to me, and then create mnemonics. And then around exam time, I would go to my notes, because sometimes I highlight, I write some things in red, I highlight, you know, those highlighters that some are orange, others are yellow. And so in my mind, I'll be seeing where I'd written in yellow, I'll remember the mnemonic and you know, that kind of stuff. But then, like, my husband was different. He was pathetic. He wouldn't do notes, but he has a very good memory. So sometimes he would actually borrow my notes and then revise them, and we go to the exams and perform the same or even does better than me. Anyway, but that's just to say that we are all very different. There's some people who are so organized, they write their notes well, like they print them out and all that. But let me tell you, you're living at a very good time in terms of learning. Information is like ubiquitous. So there are simple ways that make it very easy to remember. And you know, hearing the same thing presented by different people in different ways, seeing different diagrams talking about the same thing can be very, very useful. So the thing is that what you can do currently, you can go through your notes, try to highlight the things that you feel are the take homes for you. Go to YouTube, search the same topic. There's so many medical YouTube channels that make it, some are cartoons, some are, and then go through them. You'll be so surprised at how much easier studying has become right now. I would highly recommend just go to YouTube, search a medical channel, like search the topic, you'll find different medical channels, and then see which one speaks to you best and helps you revise best. So that's just a resource that's for free out there. All you need is internet bundles or Wi-Fi. So those are some of the ways in which you can study. But I must say, we all remember differently. But the one bottom line is that you must revise, you must go through it. As much as we have different ways of remember, you must go through something for you to be able to recall. Just some people have to do it several times to be able to remember. Other people have to do it a few times. But do what works best for you, and master yourself and your learning abilities and methods. Yeah. I can see there are followers of Dr. Najib. Yeah, there's so many Indian ones that are really good.
Yeah, Dr. Najib is really interesting.
Yeah, so
And
different people make it memorable.
Okay. Okay, so one more question is, okay, how do you manage to balance your practice, your family time, and your fitness programs?
Okay, I think, like I was telling you earlier, life is really all around. It's 360 degrees. And so even in, as much as you're in medical school and your primary focus is to be able to succeed, you don't neglect the other areas of life, because life is all around. And even now, as I practice, of course, the pressure on me is less because I'm not having exams. I just have to ensure that I keep up with my CPD points. That's continuous professional development. So I still attend webinars or seminars and you know, classes in which we discuss. But right now, my focus, of course, as a practitioner, I have medical officer interns under me. I have some family medicine residents under me. And on occasions, we are having, of course, medical schools that closed, but now we are starting to have medical students on electives. And so my responsibility is to be able to train my interns and do my ward runs, so take care of the patients, have the interns present to me, be able to guide them, and basically offer consultancy services so they can, my interns have access to me, they can reach me, they can ask questions, they can seek guidance. And so that takes care of the practice. In terms of marriage, as a married person, we take times away. Like I have my off days, I have my leave days. So beyond just having times in the evening or early in the morning before we go to work with my husband, we do getaways, we go stay out somewhere or just go out for dinner. There are those things. COVID will run out, don't worry. So of course there are those times we had the lockdown, but we take time just to spend time together. And I must say this should not be limited by resources, but you're in medical school, so I'll not go. I know all of you, I think the majority of you are still single, but as a married person, I value having my marriage doing well. And when it's doing well, I am well, I am not stressed, I'm able to have tranquility and be able to focus on the other things. My husband is a big support, even in terms of our business. Of course, I run the business Dr. Fitness, which is wellness and fitness. You can check out what I do by there on social media. If you search doctor, type in full Dr. Fitness, you'll be able to find me on Facebook, Dr. Fitness on Instagram. That's besides the point. But the thing is that I told you I'm an evening person. So after I'm done with the day, I have done my work. First things is that, of course, I have a domestic manager. I have someone who assists me in the house, assists with the cooking, assists with the kids. My kids are fairly grown up. My twins, I have twins plus one. So the twins are 12, the young one is 5. So they are fairly grown up. They don't require a lot of attention in terms of being babied, but I still value spending time with my kids. So in the evenings, we catch up, we chat, I know how their day has been. I know the projects they're trying to run because they're now at home, and just show interest in what they're doing, because I also believe as a mom, I have a lot of influence on them, and I'm trying to mold them to be good citizens and good human beings that will serve the society. So in terms of my business, it runs mainly online, but we always thinking and coming up with products together with my husband. He's a think tank. He's very creative, so he helps me a lot on that. And I have other assistants. I have a personal assistant who answers the phone calls related to the business, who administers the online classes, as in I have the classes, but she's the one who gives people login credentials, answers clients' needs and questions and that kind of stuff. So I have a team that works around me. So that takes care of the business aspect, but I have to keep thinking, I have to keep creating products. I have to engage. There are times I'm called to do public speaking. Of course, what I am doing today is just giving back, and just excited to be sharing with upcoming young doctors. So this like CSR, not quite related to the wellness per se. And then in terms of working out, I mean, you have to walk the talk. I must say, for me, I got interested in fitness when I was in medical school because I went in overweight. I wasn't bothered. I loved myself as I was, but then I started becoming aware, and I was working towards my wedding, and I wanted to look good in my wedding gown. That's how I started getting in shape. I learned a lot about, there wasn't much of online access, but I learned a lot about nutrition, and I cut down my weight. And by the time I finished medical school, I was the size I am today, and I've been able to get back after having babies. And this just because I just learned the simple things that I need to do. And I would encourage you to also take care of your health, eat healthy, exercise even when you're in medical school. Please, you still have to shelve time. I forgot to say that. Shelve time to take care of yourself in terms of just being physically active, and ensure that you're having some good meals as well, and you need to relax as well and be able to sleep. So I exercise in the evenings, and that's become my habit, and how I've been able to manage this in spite of my busy schedule is that I don't work out in the gym, I work out at home, and I've always done it for the last 5 years since my baby was 10 months. I've actually since the baby was 2 months, So I've been doing it. It's habitual. I work out 4 to 5 days of the week, and I'm very active. I walk a lot. I have a pedometer. I'm wearing one. So even my interns, you know, they know I do step count. I tend to use the longest route. So being creative has really enabled me, and being able to integrate my lifestyle into everything else that I am doing. So as I go to work, I must highlight that I'm not living in Nairobi currently. I'm living in a village hospital within the hospital campus, because that's where my husband is doing his fellowship. And so I'm able to walk to work. I use the longest route, and that helps me to be more active. And then in the evenings, I'm a certified fitness trainer, so I know the things to do to ensure that I was not able to show you my guns, you know, but I work out. I hope I have covered that. I'm a doctor. I am a wife, so I take care of my husband. I am a mom. I take care of my kids and ensure that they have good food to eat. And I am a business person, so I take care of that. And then I try to give back to the society by doing some things like now interacting with you guys out here. I hope I have answered that question. And then, of course, I take care of and this is something I would also recommend to you, taking care of your distractions. And because there's so many things out here that can be consuming your time and eating away time that you could be using for more productive things. And these are things like spending a lot of time online, you know, spending a lot of time watching movies, maybe on Netflix, or going to YouTube and watching so many entertaining things that are not necessarily medical, and or party after party, you know, that kind of stuff. Those things can consume a lot of your time. It doesn't mean that you cut off all that, but it's good to, when you're planning your time, you know, when is your leisure time? When is it that you can go like sporting? When is it that you can hang out with your friends? When is it that you can go to the salon and do your nails or do your hair or whatever? And when is the time for you to date, or, you know, try, you know, throw a few lines to that girl you've been fancying? So it's good to set aside those times. And sometimes it might be you can't study all through. Even when you set 2 hours to study, you need some breaks. Maybe after every 30 minutes, you can shelve out like 10 minutes and decide to watch a YouTube video that is entertaining, or browse social media, but time yourself so you don't go overboard. So look for something that's relaxing that you can take as a break, but beware of things that can actually eat eat away your time, and you end up wasting it. So I avoid that. I don't do much of TV, watching politics that will just discourage you. So cut away time that you don't really need to spend in some things, and then focus on the more important things, and look for time, shelve it out that you can also relax.
I hope you guys have had stop your distractions, feed your focus. So
True.
there was questions on social medicine and social life. One, how do you handle marriage and masters and having a baby? And two, how do you handle friends who are not in med school and they want to like hang out, like on church Sunday? Sometimes you have to like sacrifice that Sunday for study. They won't understand that. Like, how do you like maneuver through that?
I think, sorry, one thing I must say is that I think part of that question I've already answered, but we also must learn to say no. And that is very important, and it's actually a sign of just being sure of what you want in life, and just having confidence that you're making the right decisions. You can't say yes to everything, but remember, every time you say yes to something, you're saying no to something else. For instance, if I say yes to eating junk, I'm saying no to eating healthy. It's not always that black and white, but it's just realizing that every time you commit to something, you're missing out on a different opportunity. So when you're presented with two things, you have to choose what is more important. Remember that if, let's say, it's social events that are happening on a Sunday and you need to study to be able to catch up for your Monday for the following week for your academics, remember this is your season to be a student, and so that still takes a center stage. However, I would say that you need to give it attention 80% of the time, then 20%, you know, just a proportion of where your majority of attention is put, and 20% is on the other things. You can't keep saying, you can't say yes 100% to only that which matters to your academics. So take care of your academics 80% of the time, but you are social. If you dissociate yourself too much from what is going on with your family, with your friends, with other people out here who might not be in medical school, remember medical school comes to an end. Then do you want to be a lone ranger? Do you want to be lonely? Do you want to have no social networks? Or do you just want to interact with the medics only? I don't think that would be a balanced life. Therefore, it's good to know that on this Sunday, I can say yes. So now back to scheduling and having a calendar. You can say every 2 Sundays of the month, I'll be able to hang out with my friends like for 2 hours, or go visit, this person for 2 hours, or maybe 1 hour. You can have an agreement, or say one Sunday of the month, and it's the entire afternoon I'm going to hang out with these people, because it's also important that you start interacting with other people and get a feel of other things and a feel of life outside medicine, as in you don't want to be too tunnel visions and miss out on whatever else is going on out there. I mean, you're not going to be reading medical books only. You want to read a few novels, you want to read a few personal development things, you want to listen to a few podcasts that are helping you with personal development, anger management, time management, and so many other things that are important for your development as a person. As a matter of fact, the most successful medics in terms of practice are the ones who are very socially aware, the ones who are emotionally intelligent, because your patients are not going to be medics, they're just going to be regular people. You need to be aware of other things that are going on, that you can have a bit of, talk, icebreakers, and also have a few lines that you can interact with other people without, sounding too medical, obnoxious, and boring. So that said, it's just good to remind you that you need some kind of balance and hang out with other people who are not necessarily medics. So please don't cut out all those other people. And anyway, how will you meet your girlfriend, your boyfriend, your spouse? You're not necessarily going to marry a medic. So hey, interact with people out there. Then again, balancing for most of us as we go into masters. I know I'm not sure I have those people in here, but by the time you go for your masters in medicine or masters in public health or whatever masters you'd want to do, many times you probably have a family going on. I'll give my example. So I graduated from medical school in 2005. The graduation ceremony came actually at the end of 2006, but we finished in 2005. 2 weeks down the line, I'm walking down the aisle. And then 2 weeks after that, we have started our medical internship. My husband and I were in the same place. So kind of my internship was my honeymoon year. And then thereafter, we are posted to what it used to be a provincial general hospital. I was working in Nyeri, so together we ended up there. There was a few working out of how we ended up being there. And we got our babies in 2008, we got twins, and we were still working. And, let me tell you, you become a parent when you're ready to become a parent. I mean, your medics, you can plan that. And because children, especially when they're really young, they require a lot of attention. And so by the time we were coming to do our masters, my husband and I again started masters at the same time. We were in the University of Nairobi. I was doing internal medicine. He was doing surgery. And so we were able to stay together. We've made a lot of efforts to ensure that we are always living together. It doesn't work for everyone, but that was our aim, and God has been gracious to us. And so by the time we were going to medical school, our kids, masters in medicine, that was in 2010, August. And so at that point, the kids were about 2.5, way beyond 2.5 years. So we decided not to have more kids until we are done with our master's program, or at least I was done, because his surgery ended up taking 5 years. My program took 3 years. I finished on time. And so thereafter, we decided to have our third born. So it was juggling, of course. We've always had a stay in house help. I take care of her, ensure she's comfortable as well, because you need to have peace, someone to take care of the kids. And so that really helped. That when I'm, at work, because Masters is intense. It is intense. You have all those professors expecting you to know everything that's medical. You are pushed to your limit. You are seeing lots of patients. You're guiding the undergraduate medical students. So it was intense. It's no joke. And it can take a toll on you. So, and at that time, I didn't set my business. I mean, I set up my business. Dr. Fitness was first set up. The Facebook page, Dr. Fitness, was actually set up on the 17th of February, 2016. And yes, so the thing is that I never set up business. I don't think I could have been able to handle all that, being a wife, being a mom, and a business during the master's program. It's quite a bit. I know some people are superhumans, you can do that. But let me tell you, it's doable, but you still have to organize yourself. Know the days, the weekends, you're not on call, you focus on the family quite a bit. Know that, you know, when you have lighter classes, you know, I mean, like for us in medicine, the first year is quite intense. The second year, we call part 2, has the second year and the third year. Second year was a little light, so you do a lot of leisure catch up with family that you neglected a bit during the busy times in first year. Honestly, you miss a lot of social events, miss a lot of weddings and funerals as well, just because it's intense. And I think you just balance out, see, do what is most important besides your academics, and say no to what you don't have to do. So I said no to attending some weddings. I said no to attending some funerals. I said no to attending many birthday parties. I said no to, you know, just hanging out and all that. So that's the reality. You have to say no respectfully, and just because you have to honor yourself as well, and because you can't be everything to everyone, and because it can stretch you so much, you need to remain sane. So that is very important. So MED is crazy, but it's doable, especially when you have a family. It's extra challenging, but it's exciting, because when I'm stressed and all that, I had my family to hug me, to chat with me. My kids are not aware about all the things at work, so they will play, they will laugh, and I will laugh at them. And that's very relaxing and tells me relax yet again. Yeah, so that's how I have managed to do it. So learn to say no.
Oh, thank you for that. Also learn to say no. And okay, so let me take some questions. Okay, concerning the social aspects, we know we have friends. Okay, and how do you deal with friends who are maybe not in, who cannot understand the position that you're in? And also, how do you deal with heartbreak?
Okay. So dealing with friends who don't quite get you, first of all, I think those are friends worth unfriending, because I believe that if someone really cares about you, they should understand you well enough to know where your focus is. They should be able to offer objective critique. They should be able to support your goals, because really, I mean, you're in medical school, you're actually forming your future. You're working on your future. It's important. It's your livelihood. It's about investing in what's going to be your life long term. And so that's very important. And if you fail, I mean, medical school, I know it's crazy, you know, if you fail your exams, there's the option of getting supplementaries, there's the option of going through a retake of the year, and there's the option of being discontinued. There are people who are discontinued from medical school. So it's such a big risk to take. No, if you're not taking care of your primary agenda, it's a big risk, and you would disappoint yourself, you would disappoint your family, you would disappoint those who have been looking up to you. Remember, as a medical student, there are kids in high school being told, you see, so-and-so did this and they're doing okay, and that, you know, you're like someone on a pedestal, you are an inspiration to so many other people. So if you fail, you not only let yourself down, you're letting those who care about you and those who look up to you down. So really, someone to be your friend, or to claim or to say they're your friend, and they're not in support of your primary goals that end up in, you know, affecting your long-term goals, those are not friends worth keeping. And it's good to be aware that sometimes people can even be jealous. Not everyone, some of them, it's just that they don't understand. And if they don't care to understand, then I don't think they care about you. So you can starve them in terms of, you don't have to disagree with them, but give them less and less time. With time, they'll phase out of your life. But instead of just delinking yourself from them, aim at getting quality people into your life. Aim at getting people who are in line with your ambition, who are in line with your objectives. Even other students, maybe they're studying law, but they are very focused. Those can be good. You know, in principle, they are very focused. Those are people you'd want to keep in your life. But people trying to discourage you, people who are not objective, some of them could be jealous that you seem to be successful, and they might even want you to fail. There are few not well-meaning people. Just be aware of that. So you don't need to keep such people as friends. The other thing, dealing with heartbreak, as much as I say that in college, in medical school is like such a good time to be able to date and potentially get your lifelong partner, don't put yourself under pressure. We all have different clocks. We all have different timings. I believe God has different calendars for all of us. If things don't work out, don't like bash yourself over it. Sometimes your breakups will happen, heartbreaks will happen. Someone you really were interested in, you might discover they are not, and it might not go so well with you. It might break your heart, and that is really normal. So the thing is that you somehow have to toughen yourself. And dealing with heartbreak, I would say that if for some reason your relationship has not worked, or someone has disappointed you, it might not even be a love relationship per se. Someone you are looking up to lets you down or disappoints you or cons you or whatever. I think one thing you have to realize is that it's not you, it's not your fault. So first of all, dissociate yourself with the issue and realize that it's not your fault. It's not that you're not good enough. It's not that you're not valuable enough. Start from that point of knowing that you're amazing, you're God's masterpiece, you're valuable, you are special, you are the only one of your kind. And too bad they've missed out on being with you, you know. But know that maybe it didn't work out for your own good, you know. Things don't just happen to you, they happen for you. Sometimes you might miss out on an opportunity and end up with something better. So if things don't work out, first of all, let it not affect your self-esteem. It has nothing to do with you. It's just an event. It's something that happened. It's not you. It has nothing pointing at you. So that will help you in healing, knowing that you are a whole person. You can always rebuild yourself. You can learn from the mistakes you might have made, or look at, take stock and see what might have gone wrong. And then see what went right and work on that and build on it and learn from that. And so you're a better person as you move to the next relationship, and take time to heal, and sometimes I would give an example. Sometimes things don't seem to work out the way you want them to, but at the end of the day, it works out for your best. When I was done with high school, I remember I had this relative. This lady is a professor. She's like a grandma to me. She's a relative through my mom. And all our sons had done so well. They'd been, to best schools in the country, ended up going to States to do their college there and all that. And so it was at a time that we felt like you have to go out of the country, go to the US or go to Europe, wherever, for you to be able to succeed and do well. And I actually applied, ended up getting a scholarship, but it wasn't a full scholarship. So my parents needed to top up something so that I could be able to go abroad, do my pre-medical and then medical training. I was still interested in medicine even then. But then my parents didn't have the kind of resource. And so I just decided, well, I've gotten the opportunity to study medicine locally. Why not just do it? And I look back and I am so glad things didn't work out the way I wanted them to. At that time, I was disappointed, and that's the way I look at heartbreak. But then I was like, well, let me rebuild, let me work with what I have and see what will come out of it. I would say I am successful, not because I have lots of money or this leading doctor, but just because I am most fulfilled I ended up meeting my husband right here. Surprisingly, even him, he was pursuing an opportunity to go outside the country, but God kept us here. We ended up meeting, and I think I'm a much happier person because I met him, and I've been able to rebuild, build my career here, build my business here. So when things don't work out, start again, start afresh, do something new, just refocus, feel good about yourself as much as you feel torn at that moment, but know that you're worth it, that you're worthy of success, you're worthy of a good relationship, you deserve a good person, and that can still happen. Whoever it was that you're with before, or whatever it is that didn't work out, it was just not meant for you, but something good awaits you. When one door closes, stop wasting a lot of time looking at the shut door. Just turn around, you might see another door that's open and walk into it. So it's not the end of the world when things don't work out the first time.
Okay. I hope you guys are taking note of what is being said. So some people have questions that are not exactly time related. One of them is, can you expound on the Thriving Couples program? And how exactly do you pick yourself up after academic frustration? And how did you come to the conclusion to do internal medicine as your master's? And as a person who did IMED, what is your role in the hospital?
Okay. Oh gosh, I hope I got it all right. If I miss out something, you'll tell me. I think I forgot to be taking notes. Let me see whether I can remember all that. So once, the first one was about thriving couples. Oh my goodness. That's a page my husband and I opened on Facebook. It's hardly 2 weeks ago. This is just because for the longest time, I'm in so many other groups as well. And on these online spaces, it's been made to feel like all marriages are failing, and like there are no marriages that are thriving. And actually in that space, we wanted people to just share their stories and show that there are many marriages that are thriving. I think it's good to realize that in the society, basically, bad news travel faster than good news. And so you realize that broken marriages, people that break up, or people that divorce, catch up, the news will capture that, or, the grapevine will capture that sooner than, the marriages that are doing well. And because we've been blessed to have a good marriage, I have, and even a good relationship, I have known my husband. We've related since the year 2000. We wedded 5 years into our relationship. And we've succeeded. We are not perfect. And the essence of thriving couples is not to show perfection, but to show that you can thrive, you can be fulfilled, you can enjoy good relationships and enjoy a good marriage in spite of what is going on in the environment. Of course, the society has really changed. There's a lot of trauma, emotional trauma and all that, and that affects how we relate with other people. However, it's just good to realize that in spite of it, you can survive. You can not just survive, you can thrive. And thriving just means that enjoying and being able to be fulfilled. It doesn't mean that you will not disagree sometime. So our main agenda is to inspire and even inspire the young people, because when you have the right mindset, you'll go into marriage with the right mindset, knowing that it can be successful, and you go in with the mindset of long-term, not walking in and walking out. And you'll be more careful as you select a potential lifelong partner, because you ask yourself, is this the kind of person I would want to live with for the long term? Is this the kind of person who would integrate and be able to relate well with my family, with my friends? And most importantly, is this someone who can actually feed my dreams and my goals, and can walk with me and cheer me and give me positive critique as well? You don't have someone who is always telling you it's okay, even when you're doing wrong. They don't like tell you, babe, I think this is not really, I think we could do it in a better way, and that kind of stuff. So that was the first. And the second one that I can remember was about internal medicine. First of all, back in medical school, I made my decision to go into internal medicine when I was in undergraduate medical training. And that was after getting into the clinical years. And for us, we did 6 years. And so the first year of clinical practice or clinical training used to be the 4th year, and the second one was 6th year. 5th year was clinical, but it was in those we call external rotations that are not so intense and all that. So I think my first rotation was in obs-gyn, and the first day I walked into labor ward, I was sure I would never want to be an obs-gyn. Big ups to everyone who has done obs-gyn or wants to do obs-gyn, be able to deal with mothers and reproductive health and deliver babies. I was so sure I didn't want to deal with that kind of thing. And I think it affected me so much just going to labor ward. I decided that I will have my babies through CS. I've not gone through natural delivery. I've had cesarean sections, just so you know. But anyways, that's besides the point. And when I just rotated in and the other thing in surgery, I was just so sure I'm not into bloody mess. My husband loved surgery from the outset. So he was cut out to be a surgeon. I was cut out to be medical. And so, of course, there are 4 main subdivisions in medicine. By now, you probably know that. There's medicine, there's pediatrics. Those are the medical rotations. Peds, of course, dealing with babies. Medicine is the internal medicine part, dealing with adults. And then there's the surgical rotations where there's the obs-gyn and there's the surgery per se. When I went into medicine, I was like, I am home. I enjoy physiology. I enjoy, getting to understand things. I'm the kind of person who likes to ask myself, why? Why does the patient have hyperkalemia? So what has caused that? Was the sample of blood hemolyzed, or does this patient have a tumor? Are they having tumor lysis syndrome? Or is this patient having a renal failure, or are they having sepsis? And so they're all those things that can lead to hyperkalemia, or are they on drugs that can cause that? That was my kind of thinking. And I'm like, I like looking at the problem, asking myself what could have caused that problem, and working the diagnosis and trying to treat it. And so that is basically the foundation. That is the main thing in internal medicine. And so I just loved it. I enjoyed it. I enjoyed, clerking the patients, examining them, working through the diagnosis. I just like interrogating things, asking myself why, working it out. So I am more of the thinking person. I know surgeons think too, so there's always those issues between physicians and surgeons. But they think too, but they like to cut. They like to address the open and see and address the issue. But for medicine, we like working out. They joke around us that we think a lot, come out with differentials and do not cut the patient. So I loved internal medicine from the beginning. And so basically in a hospital, what I do, I am in charge of the medical ward. So basically I deal with people with lifestyle diseases, people with infections, with heart diseases, failing organs, kidneys, and all that, including taking care of the patients with COVID. We have a COVID care unit in our hospital and all that. So that's what I deal with. And I love medicine from the outset. It's very similar to pediatrics, but I didn't like taking care of babies who are sick. I want healthy babies. I'm not so much into, babies. I'm not the kind of person who likes hanging out with kids and all that. It's just not my gifting. And so naturally, I was not going to be a pediatrician. And so I enjoyed more being an internal medicine specialist. And we are called internists, not an intern. Sometimes we internists, because of internal medicine. And born out of that was Dr. Fitness. One of the inspirations was that I kept seeing so much of young patients with lifestyle diseases. So we're talking about diabetes, you're talking about hypertension, young patients, suffering myocardial infarctions, that is, ischemic heart disease because of lifestyle. And so it just started, affecting me, making me think a lot. How is it that I can help people influence their lifestyles to be able to prevent these conditions? And that's how Dr. Fitness was born, just to encourage and inspire people to make lifestyle changes so they can be able to live healthier for longer. I don't know which one I might have missed out. Please just remind me and I'll be able to address it.
It was a question on picking yourself up after academic frustration, like retakes and supplementaries.
Okay. First of all, failing in medicine is like so normal, you know, it's going to happen. I remember there's a time I failed my CAT in microbiology and I retook it, and that is history. And so that is normal. It's not the end of the world. Of course, there are different levels of failing. If the bigger you fail, the more the percentage, the more you're likely to be discontinued from medical school. So it's very important to be very cautious. But what happens after you fail? So long as you have a chance to do it again, do your best. Know what were the faults, which questions you didn't get right, revise hard, be prepared, do it again, and then you continue. I mean, losing is not the end of the world. You're not dead. You still have your brain. You're not paralyzed. You're not crippled. You can still do it again. I think it's good. And the thing is that you have failed in a certain subject. So what? You can't go back in time. And so you can't undo it. So the sooner you accept that it has happened, the better. I know one student who took 12 years in medical school. She's a good doctor right now. I wouldn't say who it is, but I don't know how she acted. I'm not sure I would do that. I think I would have given up and moved on to other things. But she went through medical school doing every year twice. She took 12 years in medical school. She's a great doctor right now. She's specialist. I wouldn't say why, just in what field, because you might just get to know her, but that can happen. I also know people who are discontinued, sometimes through circumstances that we could not understand. Sometimes things can go really wrong in ways that we cannot explain. They went on to do other courses and they are highly successful in the field they went into. Some of them became serious entrepreneurs. They're making much more money than, you know, some of us medics out here. So if things don't go right, you can always pick up yourself. You should not, if you're too stressed, it's even good to seek counseling, to seek support. Don't sink into depression. Rebuild your life. Don't live in the past. Don't live in that negative memory, because it can affect you if you keep reliving all that. And you can pick up yourself and still continue. You know, I mean, things happen. Like I lost my dad during internship. It was really tough. I was close to my dad, and life continued, you know. I mean, I still remember him. I still get emotional sometimes, but that's when some things go wrong. It's not the end of the world. And so medically, if you don't succeed in something, there's so many people who went through it. There's so many people who even took a year twice, or even 2 years twice, or did supplementaries. It wasn't the end of the world. You don't want to neglect your work and end up doing that. But if it happens, learn from the mistakes. If it's somewhere that you are neglecting your time management, you're bashing too much, you're hanging out party after party, you are not studying the materials you're given, you're not focused, or you're drinking, or you're spending a lot of time doing unnecessary things, adjust that, correct that, come back, do the right thing, take it as an opportunity to start afresh, and then move on. It's not the end of the world. You're still alive, you're still breathing, you're still kicking. Come on, girl, come on, guy, you can do it. Do it again. Have I missed any other question?
No, you've answered all of them. Thank you.
Oh, wow. Thank you so much, Dr. Dindi. That was a really, really interesting conversation. I know that among the attendees, there are some of us who follow your work on social media, and we got really, we got excited when you're talking about the first dates and the 100 shillings date.
Yeah, it's real.
Yeah, I'm sure that most of the attendees have been inspired and empowered by your conversation. So because there is, there is no other question that has been left unanswered, we are glad to have another speaker joining us. His name is Dr. Paul Bundi Karau. I'll just read through a bit of his bio. He's a medical doctor. He's a senior house officer in internal medicine at UN, just like Dr. Dindi a few years ago. He's the founder of the anatomy department and a lecturer at KEMU. He's an educational strategist, and he's also an author. He wrote the book, The Journey to Academic Success and Beyond. You might have heard him in the past. His story is inspiring. The book that he wrote was to share his story as his journey through a little known school in high school to become the top student nationally in his KCSE. So without further ado, I'll welcome Dr. Paul. I hope Nick is able to unmute him so that he can share a bit about his journey through medical school and share some pieces of advice for the benefit of our attendees. So welcome so much, Dr. Bundi.
Thank you very much, Benjamin, and I'm sorry for joining in late. Correction, okay. I'm no longer a senior house officer. Can you hear me?
Yes, we can, loud and clear.
Yes, I'm no longer a senior house officer. I finished a few years after Dr. Dindi has finished. I'm actually already a consultant physician, no longer even a senior registrar, because I finished more than 2 years ago. So my name is Bundi Karau. And my journey in medical school is an interesting one. First of all, having come from high school as the best student in the country, of course, it came with a big burden on my side because I had to prove that I was not a one-hit wonder. And I joined medical school on the 8th of November, 2004. Having been in the KCSE class of 2002. And immediately I was thrust into the deep end. I mean, medical school life is totally different from high school life. Because in high school, we thought you were working very hard, but I realized in medical school, you work even harder. And we were not used to failing. Actually, I had been a top student practically from class 3 all the way to Form 4. I have never been number 2. But in medical school, I learned through the hard way how to be a number 2. Because the first cut, and that one I always remember that we did in physiology at the University of Nairobi, I was ranked number 190. So you can imagine, and that is somebody who was the top student in the country. But I was able to pick up the pieces. And I remember when I finished the first year, I was actually among the few students who got distinctions in all the 3 subjects, that is anatomy, physiology, and medical biochemistry, and microbiology, so that I was actually the top preclinical student, and I won the Avenue Excellence Award during the university, the University of Nairobi Awards. And during the first year, I got interested in human anatomy. And luckily, having been, I think, the best student in anatomy in first year, I was made a demonstrator. Demonstrators are those students who teach others. Of course, they pretend to know some little more anatomy and they teach others. And it comes with a very small pay, which was a lot of money in 2006. And alongside being a demonstrator, I also, was made, I was picked among the 4 students who would sit the intercalated human anatomy degree. And human anatomy degree entailed, being a demonstrator in second year, and then in third year, being left behind as others went on with medical school. It was also a hard decision, but that time, the mentorship was so good that it was not very hard for me to make that decision. And so in the year 2007, I was left behind to become a fellow in human anatomy. And I graduated in 2007 with a first class honors in human anatomy. And after that, I was made a teaching assistant in the Department of Human Anatomy. Actually, I would say that was one of my best experiences, because being in that department taught me many things and opened my mind, as you're going to see. It is during human anatomy that I realized I could write. It's also during human anatomy I realized I could motivate people, and I started actualizing those dreams. I remember one time, after sharing my story with the late Professor Hassan Saidi, he was one of my mentors, sharing with him my journey through high school and some articles and written. I used to write even for The Nation. He actually challenged me to make those thoughts a book, and he demanded that I write that book and present to him and Dr. Ogengo, who is now the Deputy Vice Chancellor, Academic Affairs, actually was Academic Affairs in the University of Nairobi. They demanded to see the book within 6 months. So I had to go down, to go back to my room, and I started writing all my thoughts as a book. And that's how that book, The Journey to Academic Success and Beyond, came to be. At the same time, I remember one other little step that I took that actually defined my life is that I went to the Nairobi education offices and got the contacts of all the high schools in Nairobi. And I wrote a common letter introducing myself as a motivational speaker, as a medical student, and I got overwhelming invitations. In the year 2007 and 2008 alone, I visited over 150 high schools during my spare time, and I got to make big networks. Some of them are actually doctors, the people I mentored, and that actually opened a whole new world for me. At the same time, I got in touch with the Shell and BP when they used to be in the country, and they are the ones actually who funded the publication and printing of the first 1,000 copies of my book. I remember during the launch of the book, sometimes in March 2008, the Minister for Education, Professor Sam Ongeri, was the chief guest. That was a third-year medical student daring to dream. Of course, in 2008, after anatomy, I went back to medical school, and I was a class behind, my initial classmates. And so I belonged to two classes, the class of 2009 and class of 2010. And I find myself in the two WhatsApp groups. And one of the things that, of course, used to bother me a lot those days is that my girlfriend was a class ahead of me, because I met my girlfriend on the 8th of November 2004 when we were registering for medical school. And so we started going out sometimes in 2005, and she was ahead of me because I was left to do anatomy. And it used to bother me how it would look like. But eventually, I thank God, it worked. One of the other things that being in anatomy, did for me was to open up my mind to research. Some of the projects I did, in human anatomy, I remember very well. I was able to publish over 10 papers in European journals while in third year and fourth year of medical school. Actually, the most high quality publications I made them as a medical student. I remember meeting one professor, and he was surprised that a university student could actually write those papers. So much so that I actually became a reviewer for the Journal of Clinical Anatomy, which is the official journal of the Anatomical Association of America. I was actually a reviewer, and I even remain a reviewer up to date. The other thing, of course, was opening up networks so that I could, speak to many people. And that time I became so audacious, I could, think of an idea and I go and present it to somebody. I'll give you one example. When I started the journey of speaking in high schools, I thought of a strategic partner, and this took me to Dr. James Mwangi of Equity Bank. And I went to his office, and before I went to his office, I had written a 10-page proposal. And when I shared with him, he was so impressed. He didn't even wait to think about it. He just summoned, one of his officers, and I was assigned an official vehicle and a driver, and they were to make arrangements for the high schools I was to visit in central Kenya. And I remember we started with his high school where he was the chairman of the board. That meant that I got to visit even more high schools. Most of the Saturdays, I was basically busy traversing the country, and of course, making many networks and making many friends. During that time, I also toyed with becoming a writer, even more than a medical doctor, but I dropped the idea. And I hope after some years of practicing medicine, I'll go back to becoming a writer. To show for it, I have a novel, which is not yet published. It has been with the publisher for the last 2 years, a motivation, and actually a fictional novel. And I hope one of these days it will be published. Also, I served in the Christian Union, the medical school Christian Union, and I remember, in line with my, my dream of becoming a writer and also my writing talent, I became the editor, and we launched a publication which I hope runs up to date, called The Flaming Sword. And it was so well received that all the copies we printed, the 100 copies we printed first, all of them were bought out in the first printout. Of course, I had my own share of failures in medical school. As Dr. Dindi has said, there can never be success only in medical school. You're reminded of how much you don't know. And I remember one of my years that I really don't like remembering is my 5th year, because out of the subjects I sat, I got a C in 2 of them and a B in 1 of them. And that is the first time in my life I've ever gotten a C. But thank God, one of them that I got a C is internal medicine. But I went back and still did internal medicine, for my postgraduate. I know one of the questions I've been asked by medical students a lot is, how comes you did that human anatomy and then instead of doing surgery, you decided to do internal medicine? Actually, when I went to do anatomy, I thought I was going to be a surgeon. But when I went into anatomy and, I went deep into research and then went deep into public speaking, went deep into writing, I started looking for a career that would marry with my character and would also afford me time to do all those things. And I couldn't find any other that was intriguing. And for an inquisitive mind, I found internal medicine. At that time also, I became interested a little bit in neuroanatomy. And the only way to, actually see my emerging anatomy and, medicine is by becoming a neurologist. And I hope one of these days I'll be able to become one. So I finished medical school in the year 2010. And I would say I finished with three degrees, because I finished with anatomy, I finished with medicine and surgery, and I finished with a wife. And that to me has been a great achievement. After that, I went to Kangundo District Level 4 Hospital for internship. It was a small hospital, but again, I chose it carefully because I knew it was a training center for Moi University for family medicine. And it afforded one of the best learning environments. Actually, some of the work ethic that I still have up to date is what I learned at, during internship. And after internship or during internship, as fate would have it, I wanted to join the University of Nairobi to, as a tutorial fellow in the Department of Human Anatomy. The chairman was on my neck, but just as I was doing the applications, Kenya Methodist University was starting a medical school, and the deputy vice chancellor came all the way to see me. And I told him I had to share with my chair in the University of Nairobi. And when I shared this with my chair, he told me, you know what? This is a new opportunity. It will be, maybe good for you. It's going to go find out. There's nothing you're going to lose out. And I came and founded the Department of Human Anatomy as the sole lecturer in human anatomy. I was teaching histology, embryology, and gross anatomy. And I remember when the external examiners from the University of Nairobi came to examine, they could not actually believe that one student with only a BSc in human anatomy and MBSHB could do that, because the students were very, very good. After 2 years, I went back to do internal medicine. And of course, during internal medicine, I went back to the University of Nairobi Anatomy. I taught there for the 3 years I was doing my MN anatomy. And after that, I came back, to Meru as the, still in human anatomy and internal medicine. And when I came back, of course, I want to be an anatomist and a physician. So when I came back, one of the things I did was to do so many courses in neurology. I've done trainings across many countries in the world. I'm almost a neurologist, although I don't have the certificate. The other thing I did when I finished MN was actually to do a diploma in creative writing with, Writers Bureau Manchester, because I wanted to actualize that dream. That dream seems to have almost died because I've become one of the busiest physicians. Right now, I'm just from a busy clinic. I had a very busy morning. I've seen almost 40 patients. So I don't know, maybe 2 or 3 years from now, I'll retire from medicine a little bit to actualize the other dream. At the same time, I have registered for a PhD in human anatomy, neuroanatomy, and I am moving slowly but surely in that. Of course, I don't do only human anatomy and medicine. When I came back to Meru, I was appointed by the governor as the chair of the Meru Youth Service. So I chair a county parastatal as a chairman. I'm in charge of a budget of around 120 million every year. And this is another challenging job because I'm always on my back in case EACC, the anti-corruption body, comes, chasing after us. And we still, we still do it. I have to advise the governor on youth affairs. I meet him approximately once every 2 weeks, or I speak at length with him or the deputy governor. And of course, when you do something well, the community comes looking for you. I also chair the academic committee of the board of one of the national schools here, Meru School. And I'm also in the board of my former high school, Kanyakina High School. During the last board nominations, I got almost 7 nominations to be in the board, but I refused because I was being split apart and I was becoming inefficient. I'm also the patron of my former primary school, and I've spearheaded the revamping of the school. Over the past 3 years, I've actually raised personally, I think personal cash, over 2 million. I've made almost all the classrooms, and last time I took quite a number of people and were able to make a library. So that is who I am. That is my journey so far, full of ups and downs. I wouldn't say I'm a sharp human being. I would just say I try very many times. My memory is not very good, I would say, but I keep trying. When I am reading something, I read many, many times until it sticks. And one of the other things I read is that I read very many novels. I try every month to have a novel. Some of them I don't finish. I'm actually just in front of my small library, and I'm clocking around 150 or 200 novels, and I always go for the fictional ones and a few autobiographies. So that is who I am. I'm a mentor to many people, some of them who I fail because of my busy schedules, especially because I run a clinic. I know I've become a bad mentor, but I'm trying my best to correct that. Thank you very much, ladies and gentlemen. I will be ready for any questions. But as you can see, I have a lot on my plate, but I thank God still for the opportunity to serve His people. Thank you very much. Benjamin?
Wow, Daktari, that was really inspirational. It was like a series of inspiring achievements after another, and I'm very sure that the attendees have been very inspired. So I'll start with a light note. You saying that you graduated medical school with 3 degrees. That was an interesting bit. Yeah. So from what you've shared, I gather that there is so much that you did while you were in medical school, including publishing 10 publications in 3rd year and 4th year. Being a motivational speaker, spending like most of your weekends out there to inspire people. You had a relationship that was going on and you wanted it so badly to work out. You are serving in the medical school Christian Union, and you are a writer at the same time. How are you able to balance all this without one side, sidelining one a bit, part of your work and making sure that all these work out?
Thank you. One thing I would remark from now looking back is that actually in medical school, we have a lot of time. That's what I realized. Because when I came out, that time has evaporated. I mean, seeing patients is one of the most difficult things. I mean, having responsibilities, but when you are a student, you are looking for the responsibility. Nobody has given you any responsibility. I would like to add that it is during medical school that I learned that actually there are many opportunities for travel. It is during medical school that I first, during my third year that I first traveled out of the country. And from there, I went for many, many conferences, all of them on scholarships. Basically, I would say I was a very aggressive human being because I remember in fourth year, I got an International AIDS Society scholarship to go for an AIDS conference in Cape Town. And the same year, I got an AIDS Vaccine Initiative scholarship to go for AIDS Vaccine Conference in Paris. And when I went there, I was just mingling with, big professors and vaccinologists. And I was just this humble human being. How did I achieve it? I would say one of the things how I managed all those is doing the right thing at the right time and not putting off anything. During the week, I used to make sure, one of the ways I never used to make, I used to make sure my academics don't suffer. I used to go to the medical school library every evening for 2 hours. That was all my reading, and I never used to read over the weekends. And of course, I would make sure I'm in the ones, and the ones, some of the afternoons were free, so I would do those other things. That was not possible in first and second year because, the nature of the classes is that you are full-time in class. And even during anatomy, the first 6 months, BSc anatomy, it was like that. So to me, the thing is that don't put off anything, do the right thing at the right time, and then keep seeking out opportunities. This internet has so many opportunities. If as a medical student, you want to travel, you will. There are so many scholarships, many, many of them, and there are many people who are willing to sponsor people. I remember I used to Google and find a neurologist in Cape Town, and I emailed them there and then. I tell them there's this neurology conference that is happening. How can I access a scholarship? And they would tell me, apply in the World Academy of Sciences, do this. And whenever I would do that, most of the times I would find myself succeeding. So you have to learn to be a quick writer. Like when you're on your computer and you see an application, sometimes I would get an application for a conference in China and I would apply within 30 minutes. I would write my personal statement and I'll finish there. I never used to say, next week I'll do this and that. To me, that's how I was able to make it. And one of the worst things you can do in medical school is to say you're a bookworm. You want to be in the library all the time. You want to come out, as a doctor with, A in all the subjects. Very well, A's are important, but the networks you make are to me, could be even more important. So seek out opportunities and network, even as you make sure you don't get receipts, but make sure you don't become a bookworm. Being a bookworm is actually not what makes you a good doctor. What makes you a good doctor is staying in the ones, knowing how to relate with patients, the relationships you form with patients, and being humble. I can give you my personal experience of being a physician in Meru. When I came, I opened my clinic 2 years ago. And within the first 3 months, I had broken even. I think I hope nobody will interpret this as bragging. But within the first 3 months, I had made my first 1 million, basically from consultations alone. And it has just grown from leaps and bounds. Now I'm even able to give opportunities to other young doctors to come and practice alongside me and mentor them along the way, basically because of patient referrals, because they know this is somebody who can listen, and this is somebody who is humble, and this is somebody who, when he doesn't know, he actually is able to consult. There are many times, even today, when I tell the patient, this one I don't know, let me just call Professor Gola or some professor there and hear their perspective. And I realize actually patients do like that. Thank you very much.
Wow, when I thought that the first presentation was inspiring enough, you've even blown us more with so much that you've done. This is a point where you get and you say that when I grow up, I want to be like you. So thank you so much. That was really nice. And as you have said, I want to reiterate that we need to be more proactive and seek these opportunities when they come. And opportunities and network will go a long way in molding us to work in the direction that you have. I'll welcome questions from our audience, and as we are waiting for more questions, I'll quickly read through some of the questions that we've received. So our anonymous attendee asks, what was your reading culture in medical school now that you've managed distinctions? So maybe you can, I know you've mentioned that you used to study 2 hours in the evening every day, but maybe you can elaborate more on that, because it is an important question.
Well, let me say, in first and second year, I was a bookworm. And I was not the only one. I think there was a lot of peer pressure to be a bookworm. But after that, after second year, many people let the gun. But that's where you realize how important it is to study smart. To me, in the clinical years, I used to read around the patients. I would look at the commonest cases in the ones, and I would go and read those cases first before I read the rarer stuff. The other issue, of course, is to always have a notebook wherever you are, whether in a class, or in the library, or even in the ones. And then, as I said, once you find something and you think it's worth reading, you read it as immediately as possible. Even my emails, when I don't reply an email immediately, chances are I'll never reply it. So to me, it's about being a quick reader. It's about making some notes, and it's about being constant in what you do, or establishing a routine in what you do. I've never, after second year, I'll never say I'm a bookworm. I just try. And when I find something is important to read, let's say, for example, I'm reading about multiple sclerosis. I read 2 or 3 sources. I don't get satisfied with one source. I read 2 or 3 sources, and maybe one of them should be a research paper. So that has been how I have been reading, and it has always worked. Thank you.
Thank you so much, Daktari, for that. Quickly, we'll go to the next question, and another attendee is interested to know the difference between neurology and neurosurgery.
Oh, okay. Neurologists are physicians, like myself and Dr. Esther Dindi. When you've done internal medicine, Master of Medicine in internal medicine, you become a consultant internist or physician. And after that, you can choose to go to a subspecialization like neurology, cardiology, gastroenterology, nephrology, those pulmonology, those are specialties, or infectious disease. Those are subspecialties within internal medicine. So a neurologist is an internist or a physician who has gone a step ahead and done another degree or fellowship or diploma in neurology. Hope that is understood. And they usually they usually treat the diseases of the brain that don't involve surgery. For instance, I can tell you the ones I've treated today. I see patients with myasthenia gravis. I see patients with multiple sclerosis. I see patients with stroke. I see patients with dementia, Alzheimer's dementia. I see patients with Parkinson's disease. I see patients with headaches like migraine, meningitis, some cancers of the brain. Those are neurology patients. On the other hand, a neurosurgeon is a surgeon, either who did a Master of Medicine in General Surgery and then a diploma or fellowship in neurosurgery, or went straight into neurosurgery, because nowadays it is possible to go straight into neurosurgery, although it takes quite long. And their work is to deal with surgical diseases. For example, somebody has a brain tumor. They go in and remove it. Somebody has a hemorrhage of the brain. Somebody has been in an accident that has fractured the skull and is bleeding as an epidural hematoma. They are the ones who evacuate it. Somebody has a tumor of the spinal cord. They go in and remove it. The bones of the spinal cord of the spine are not well aligned. They go in and align them. That is a neurosurgeon. So those are 2 specialties who work hand in hand, but doing 2 different things. The physician looks at the medical aspects. The neurosurgeon looks at the surgical aspects. And when the neurosurgeon looks, let's say, operates on a patient, the patient goes into coma, the person to manage that patient will be the neurologist. So we refer patients to each other. I know the question at the back of the mind, which one of the 2 is better? It depends on where you stand. If you are a physician like me, you say neurology. If you are a neurosurgeon, you say neurosurgery. But to me, in medicine, there is no line that is more glorious than the other. The glory of our specialty depends on the people who practice it. It is the practitioners who make it glorious or not glorious. In terms of money, it goes without saying, it also depends, on who is practicing, how much do they charge, what is their network of patients, do they have many patients, they get only one patient a month. In terms of respect, again, it is how you carry yourself as a specialist that makes people respect or not respect you. So basically, to me, in terms of those softer details like respect, money, satisfaction, those are quite individualized. In terms of practice, the difference is that one is medical, the other one is surgical. Thank you very much.
All right, thank you so much, Dr. That was that clearly answered the attendee, I believe so. So we are really honored to have you in this discussion today, together with Dr. Esther Dindi. I'm very certain that our attendees and including the panelists have been inspired, and we are going to move forward with the weekend with new perspectives and new, even higher goals. So from here, I'll welcome the RePub team to make a presentation. Just to mention to Dr. Bundi, RePub is before even they introduce it is an organization that has come in to promote research in undergraduate. So they are going to make a presentation for the benefit of the attendees, and maybe you as someone who has done so much research, you can get interested to even mentor students through research. So the RePub team, it is your time to guide us.
Thank you very much. Before they present, I will say, you allow me in the next 10 minutes to exit. I actually was to go back to hospital and see some patients. So I will just listen. I hope the RePub people will bear with me. I'll just listen to the first few minutes and then I'll exit. But of course, these are very important forum to bring together future colleagues. I mean, this is once you're in the medical school, you're a potential doctor. So to me, always being with you is a joy that I would like to relive again. Thank you very much.
Okay, thank you so much, Dr. Maybe in case in that case, now that you are almost leaving, are there final words that you will be interested to give the audience?
Maybe my final ones is that some of the people here, I'm sure they see a dark cloud in that, the kind of opportunities that we used to have during our time, like the government absorption and direct, are gone. But let me encourage you that opportunities for doctors will never end. There is no doctor who will ever tarmac. Opportunities are there, even some of them created by yourselves. So just open up your mind and don't be afraid. There are opportunities in and outside the borders of our countries, of our country. And so there's nothing to really fear. Just do your thing, do what, my mantra is, do what you have to do today. Tomorrow will take care of itself. So if you worry about tomorrow and there's something you have to do today, you can imagine what will happen with what you have to do tomorrow. So, today I have to see this patient, I have to read this book, I have to do what I'm doing. There's a day I was saying, I want to maybe go back to Nairobi and practice there, maybe stop teaching, and then do a PhD. And I was with a colleague who really encourages me, and he told me, what about now? Do whatever you're doing now, and next year when it comes, if you go, well and good, you go. So that is the mantra I want to live with, that what I'm doing now is more important, and therefore I have to do it to the best of my ability. Not that what I'll do tomorrow or what I'll do next year. Thank you very much.
Well, thank you once again. So quickly, Ashwinda, the floor is yours.
Okay, thank you very much. Hello, everyone. My name is Ashwinda Bamra. I'm finally a medical student at Moi University, and I'll just be giving you a quick brief about RePub today. RePub, which is one of the organizations, as you know, which has been involved in these weekly sessions as such. So I'll just put up a small slideshow to take you through what RePub is about, and how anyone can be able to sort of send in their work, and how we encourage more of our colleagues and our students here in Kenya to be able to share the work that they've been doing so far. So I hope you can all see my screen now. Okay. So RePub basically initially started off as a collaboration between the Medical Students Association of Kenya and Daktari Online. So at the initial sort of, excuse me, in the initial outset, it was supposed to be this concept or this partnership that allowed students to be able to bring forward their work, to be able to, I mean, students at all levels of undergraduate training in medicine are able to sort of participate in different types of research and different types of clinical exposures, and often don't get a lot of opportunities to be able to share this work outside with the rest of the scientific community in the world. So when the concept was brought up, that time RePub was purely just about this platform that would allow students to share this work outside. But sort of grew off, and now RePub is basically composed of two major arms. And we have what is the RePub Healthcare Students Journal, which is now that publication platform. And we have what is called the Medical Education Wing, which is still sort of being conceptualized and will basically be sort of an avenue to give students in training within Africa and beyond, as well as healthcare professionals, sort of this continuous access to emerging medical education and other resources that they can use in their clinical practice. So what our emphasis right now is about the journal itself. And as mentioned at the inception stage, it's just this publication journal that helps give this platform for students who are interested in sharing the work that they've been able to do within their training, so that they can be able to publish it out there and be able to, you know, make this publicly available along the way. And this is also, of course, this came about because of the obvious understandable challenges that students face over time, one of which is always significant cost implications that often accompany any attempts at publication. So RePub is basically, the RePub journal is basically purely an open access model, and it's also hosted by the Open Journal Systems platform, which is designed by the Public Knowledge Project. So the idea here is that we want to try and maintain this open access concept throughout the entire process, so that there's no concept of any application processing fees or publication charges, and whatever work is hosted by the RePub journal in this case is made publicly and freely available for anyone to be able to use it, while at the same time giving the due credit and acknowledgement of the efforts of whoever has done this research and this work. So the idea is that we're just trying to sort of eliminate that cost barrier that would otherwise come into play to both a researcher trying to get their work out there, as well as somebody who is needing this new information to be able to access this information at the same time. So the objectives of RePub and the RHSJ actually work beyond just the journal in this case. So the idea is sort of to have this holistic concept that encourages increased awareness as well amongst medical students, as well as building skills and capacity. And that's why we've been trying to sort of engage with other partner organizations, like we have SCOMER over here, to try and have a wider sort of awareness about research, as well as to help build more capacity through trainings and webinars. And I think some of you maybe, for example, may have attended some of these past webinars that we've been able to host in partnership with some of these other organizations. So this is just some of the work that you can be able to submit. As you can see, it ranges from the basic research articles and original articles that you do, as well as clinical research that you can do in your clinical years, all the way to case reports and case series for cases that you see in your clinical practice when you're in the wards and doing your ward rounds. And then beyond that, as we will go along, we'll also be sort of accepting other sort of publications in the form of review articles, meta-analysis and literature reviews as well, and other editorials that are done as well, depending on how the turnovers come along. So as we mentioned, it's our central focus in this case is to give this opportunity for all undergraduate students. And even though right now we're sort of established and based purely in Kenya, the concept is that it's open to everyone in the world, and it truly lives with the ethos of what open access is supposed to be about. So basically it gives this opportunity to a healthcare student anywhere in the world to be able to publish the work and be able to also access work that has been published on it. And as I've mentioned, it's immediate open access charges that are usually made either for article processing or publication thereafter. This being the major sort of advantage that we're trying to bring out for especially our students, so that cost does not become a hindrance to be able to put your work out there. However, that does not mean that quality has to be compromised. And so we've sort of adopted this very unique review process. So as you know, RHSJ in this case is purely being run and operated by healthcare students, just like all of us here, undergraduate students in medicine and other courses. So to ensure that element of both building capacity amongst undergraduate students, while at the same time trying to ensure we have sort of this integrity and quality in the work that we do host under the platform, we have this sort of a dual review process that we've incorporated. So in initial peer review, for example, is conducted by peers, colleagues in undergraduate courses who are able to who have experience in either being trained in research or they've conducted research themselves, and therefore they have an idea on what to look for and what makes quality research. But that sort of does not bestow the entire decision making on them. So to ensure transparency and independence and integrity, we then have a second review stage, that work that has been deemed acceptable by the peer review stage has to go through. So this senior review now has to be conducted by what are called our consultants or senior reviewers in RePub. So these are basically established academicians, clinicians, people who have at least attained a master's level of education and training in the health sciences. So they're the ones who sort of then look at all the work that's passed through the review stage and looks and is worthy of publication. So they have a final call and they have a final decision in saying that yes, this is work that we can be able to put on our platform. And the idea here is just to try and add this extra layer of security to the work that you're trying to put out as well, so that you know that it's gone through a professional's hands and they've been able to give it an objective perspective to it. And at the same time, to somebody who's reading the work as well out there, they know that your work that has been published over there has been seen by a professional, and therefore they can rely on the information and apply it clinically or in other settings that they want to in the information. And in terms of the review process, still it's a double-blinded review, which means that the identities of both the author and the reviewer at all times remain concealed. And the idea again here is to try and be as objective as possible in the work that we're trying to put out and review in this process, so that we don't end up having any conflicts coming about and any questionable elements of the work that we put up on our platform in this case. So the submission process, if you go to the website, the link will be at the end of the slides over here, but the submission process is quite easy. So when you decide to just make a submission, this is the first screen that will just come up to you, and you'll just see a short list of key sort of requirements that need to be fulfilled, as well as some key documents that you will need to submit downstream in the process. So you can just prepare them beforehand. And then once you have that, then you just have to acknowledge this. So this is an important part of our journal as well. And as I've mentioned before, it's you accepting as an author to uphold that the work that you'll be putting up will be subjected to the concept of open access in this case. So the idea is that all this information will be made freely available. However, the credit and the due accreditation and recognition of your role as a researcher is not taken away from you. So while it's made openly accessible and freely available, you will always be giving credit for the work that you've done, and it's being hosted by the website, by the platform. So the rest of the process is usually it's quite a user-friendly interface. So at each step, it just guides you on what you'll need to be submitting. So for example, the first part, you're just trying to put up what part of the article or the submission you're doing. So is it the introduction? Is it the main manuscript? Is it a ethics review form, etc.? So you'll just be selecting which document it is and then uploading the necessary file with the buttons over there. And then after that, you just have to add in just your details, the title of the work, the abstract, and the rest of the contributors or authors who helped with the work as well. And then after that, finally, it's a short process, as you can see. Once you've entered the key details and uploaded the main documents, then it's just about confirming your submission and sending it in. And then basically that's it. Then thereafter, as you saw in the editorial review process, the editorial team sort of receives your submission. It's subjected through an initial standardized plagiarism check just to ensure that it meets, conforms to set publication standards. And then if it's basically met the basic structure criteria, then it's passed on for a junior review, where at least 2 junior reviewers look at the work. And then if they find the work is favorable for publication, then the final decision making is sent to the senior reviewer team, who then finally make a decision. And then thereafter, it's decided whether it can be published in its current form or if there's any changes that can be made. And then during this entire process, there's a continuous engagement and communication that's going to be maintained with you as the author to help you understand what stage the work is at and what basic changes can be made. For example, if they've come out from a recommendation of a reviewer, to help improve the quality of the work and how we can make it better, basically. And beyond that, we've tried to set up systems that basically make sure that any work that comes in and is put up at the platform it upholds the highest levels of ethics and standards in this case. So this is ethics at the level of both the authors as well as the reviewers. So in the authors, we've tried to cover all the basic elements to ensure that all the work that's being submitted by you as an author has credibility and it's free from any conflicts and plagiarism, for example. And a lot of the details of this is actually, all of these areas are actually described much more in detail in the website, which has the author guidelines, which helps to really help you understand. So don't be afraid of all of these, very legal sounding titles here. They're really just very easily broken down. And in most cases, you just have to sort of be aware of when you're doing your work to ensure that you've sort of incorporated certain elements to ensure this. And then on the side of the reviewers, we also have to make sure we've upheld ethical standards. And so we're using standardized tools that are already in place and standardized guidelines that are already accepted and published already that help guide our reviewers, so that the reviewers looking at the work are also very objectively guided. So this includes overall guidelines as per the COP standards, and then also depending on the kind of publication. So for example, if it's an original article, their review in this case is not just going to be subjective. It's guided by a set of a preset checklist and a preset guideline that's been published by research authorities already, so that it helps guide them in their decision making as well. So it's to try and ensure that we're being as objective as possible at each step of the way. And beyond that, as we've mentioned, research, RePub and the RHSJ basically are not just about a publication platform, but they're also about continually empowering and helping to build capacity as well. So we have a mentorship program that we are designing at multiple facets. So you'll be hearing about that soon as well. And the lecturer to student mentorship, for example, and peer-to-peer mentorship are the ones that will be openly available, whereas the reviewer mentorship will be the one that will be sort of an in-house training that all the junior reviewers, for example, will be getting from the senior consultants in this case, to try and help them improve in their skills and become better researchers, both in the work that they do as well as the reviews that they'll be conducting. So that's just a brief about what we are and what we do so far, and also just to take you through how you can be able to share your work. If you have any clarifications, please do feel free to contact us at any of these handles that we have. This is the website that we have for the main website, and then this helps you take you to the portal that I described for submitting your work in this case. Alternatively, we have campus representatives that are located in each medical school within Kenya. So you can be able to sort of pick up on any representative for your school and be able to contact them, and they'll be able to share more information if you'd require. Thank you so much for your time. Thank you.
Thank you so much, Ashinda, for that comprehensive presentation on RePub. I hope that the information has been passed and that the attendees will follow up after this. So finally, we've come to the end of our webinar, and I want to welcome Quinton to give us a closing remark and vote of thanks. Quinton.
Hello. Hello.
Yes, go ahead.
Okay, my name is Quinton Clever Todur. I am a student at KISS University pursuing Bachelor of Medicine and Surgery. I would really like to thank our speakers in absentia, Dr. Bundi Karau and Dr. Esther Dindi, for an insightful and inspiring presentation. This will really go a long way beyond in guiding us towards the depths of medical school. I also want to thank our esteemed attendees who have been very patient during this time to gather all the information that has been given, and I believe that you've scored as much for I have benefited. I also want to thank SCOMER in collaboration with RePub for facilitating this webinar. We have this platform because of your grace. I also want to thank everybody who has been keen, the panelists who have been here for ensuring that members have joined in time and that the event has gone all well. Before I conclude, you will be shared briefly. Kindly fill in this so that you can get your feedback so that you can better our services next week, same time, same place. Kindly keep in check. Thank you. Have a blessed week.
All right, we are free to leave, but there is a feedback form that you can fill as you're leaving.